What we're going to do is we're going to draw blood for the PRGF like we talked about. So I'm just going to, you ever have any problems with people drawing blood?
Mm-hmm.
Good. Looks like I'm not allowed to talk. Mm-hmm. Okay, let's see what we can do here. I'm going to have you make a fist for me. Good. Good. Are you doing okay? Good. Just go home, relax. I don't want you to do a whole lot of things today. Just take it easy. Because we're doing a large procedure on you, I'm drawing 6 vials, which are about 9 cc's each. But that way we'll have plenty of the PRGF that we need for the whole procedure. Okay, now that I have all the blood drawn from the patient, I'm going to take this over to the centrifuge and spin it. It'll take about 8 minutes for it to spin, and then we'll have the different layers of the PRGF, and we'll be able to separate them out and pipette it all. Now that we have all the blood drawn, we're going to put it in the new Endoret machine. There's a place for 6 vials, which is what I drew, so I'm just going to open up the little containers and place each vial in a container. Since I have 6, I'm filling up the whole centrifuge, but if I only had 4 or 2, I'd make sure that I made sure the vials were across from each other so that when it was spinning, it stayed in balance. If you ever draw blood and you end up with an uneven number of tubes, you can always fill one of the tubes with water and put it in the centrifuge anyways, and it will still spin just to keep it balanced. And once you load it, you just close it until it locks, and it'll show you it's locked. And then these are the 9 ml vials, so you push the 9 ml vials, and then it will start to spin, and it takes about 8 minutes for it to finish. And when it's completely finished, it'll beep, and it will unlock for you. Okay, once it's done and it stops spinning, it's just about stopped. Okay. When it's finished, it automatically unlocks, so you can turn and get out the vials. When you take out the vials, you just want to be careful that you don't turn them over or turn them sideways so that you don't mess up your layers of PRGF. Okay, once I have my blood drawn and ready to go, then I typically sit down while I actually do the PRGF just because I want to be on the same eye level as what I'm doing. Okay, now that we have the blood drawn, what we're going to do now is start to separate out all the different fractions. So what I'm going to do is I'm going to put my tips on my pipettes. There's 2 different pipettes and 2 different tip sizes. Okay. And then I'm going to start to actual pipette out the blood from the containers. The other thing I'm going to do is I'm going to open up, these are just empty vials, which is where I'm actually going to put the material that I take out of the blood drawn pipettes. Anytime you put material in one of these pipettes that you activate with the calcium chloride, you're done. You cannot use that tube again. So when we have a big case like this one where we're doing a couple different fibrins and bone and a plug, then I always have to have extra vials. First thing I'm going to do is I'm just going to take the lids off of these so that I don't have to worry about taking it off later. These are empty, there's nothing in them. Like the blue lids all have the anticoagulant from when you draw blood, but these are just empty, clean, sterile vials. And then I'm going to remove all the lids from my blood so that I don't have to do that as we go. And then with this, once again, just be careful. You know, you don't want to tip it and mix up your blood. If for some reason you drop one with the lid still on it and it mixes it up, you can actually put it back in and respin it. When I'm doing the PRGF, the very first thing I always do is I always go ahead and separate out what I'm gonna need for my fibrins and my bone and my plug first, just so I can get those going, especially the fibrins. They sometimes take a little bit longer in the oven to set up. So we're gonna do that first. What I'm gonna do is I'm gonna take the top layer off of all 4 of these vials, and then I'm gonna take the second layer off of all 4 of these vials. And that's what's gonna make my fibrin. When you go into pipette out, you wanna make sure your tip is in the top. You don't wanna go down too far so that you're just drawing off the top layer. And then just put it in your other vial. And then I'm gonna do the top layer off of all 4 of these. And when I do that, I'm actually going to put all 4 of these top layers in one vial. And then what I'm gonna do is I'm gonna go back through with these same 4, and I'm gonna take the next layer, and I'm gonna put all 4 of those in the next vial, so that I'm using exactly 4 1,000 IUs in each vial. This is kind of just the way I do it. It keeps it simple for me. It makes it so that I don't have to count and I don't have to calculate later. And it's very consistent so that I get the same thing every time. Now I'm gonna make a third one here so that I have my plug. I have 2 more full vials, so what I'm gonna do here is I'm actually gonna take 2 out of each one, which is what I did here. So I'm gonna take my first one and my second one. And then I'm gonna do the same thing on this one. And what that does is that still gives me the top layers for my fibrins or my plugs, but I have 3 vials here that are all exactly the same. So they're all ready to go ahead and activate for PRG, for the fibrin or for the plug. Okay, then the next thing I'm gonna do is I'm gonna go back to my original 4, okay, and then I'm gonna take the next layer off and place it here, and that's gonna give me 4 vials of the same thing. After I do that, then what's left in the vial of the blood is the PRGF. The very best stuff is still left in the vial. So I would use these 4 here for all my fibrins. This would all be fibrin or plug. And then what I have left in these 4 vials is what I would use for my bone and for my liquid. And if we were doing dermis or some kind of tissue graft, I would use this, the better stuff, to actually soak in the tissue. So what I'm gonna do now is I'm gonna go ahead and draw the next layer off for my bone of the first vial. And all of this, like I said, this is the most concentrated. So this is what I really want to use for the bone or for activating tissue and for his liquid. And I don't need as much, so that's about 2 of the 1,000 I use for my bone, because I don't want to have too much with the bone. And now that I have that drawn off, I'm going to stop drawing from this right now, and I'm going to go ahead and activate what he's going to need first in the surgery, because it takes a while to activate. That way it's already in the oven, and then I'll go back and I'll draw off the rest of this to give him for his liquid and for anything else he might decide that he needs for the surgery. Okay, now what I'm going to do is I'm going to take the calcium chloride and use it to activate the different layers of the PRGF. And what I do is I just pull out some calcium chloride. Everybody does this a little bit different, but I pull out a little bit of calcium chloride just so that I have enough. And then I just stick it in a dish like this so that I can pipe that out what I need while I'm working. You know, and just put that over there. What I'm going to do now is I'm going to use the smaller pipette to actually put the activated calcium chloride in here. I did all of these exactly the same. They're all basically 4 IUs or cc's of material. So I already know that with my pipette on 50 that it's going to be 2 of these in each one of these to get them to set up for my fibrin and for my plug. So, and like I said, I do this the same way every time so that it's not a thought process anymore. I just do it. It always comes out the same. And I always have a good product that comes out. So what I'm going to do is I'm going to pipette out 1 and then 2. And I'm going to do that in each one of these first 4 vials. And this is going to give me 3 fibrins, and then I'm going to do, the last one's going to be a plug. And I'm going to go ahead and activate all of these, and then we'll put them in the machine. One thing I do want to show you is that I modified the tray in our oven. So if you see on our top tray, there's a hole that's bigger. I did that for the plug. You can see it. So that I can put the vial in there without having to put the whole thing. I'm going to remove this lower tray and just leave it out because I don't need it. And then I'm going to mix this one time and then put it on the dish. I'll do it with the other hand next time, James. And I'm going to slide it into the oven. So I'm going to take this out like this. It's already got the calcium chloride in it, and I'm going to mix it. And I'm going to put it on my dish. And then I'm going to put my dish in the oven. You can do this a couple different ways. You can take the tray out of the oven, put everything on the tray, and then stick it back in there. It's up to you how you want to actually do all of that, but this is how I typically do it. I just leave the tray in there. Then this last one that I did, this is going to be my plug. So I'm going to mix it just like I would before, but I'm actually going to leave it in the vial. This is why I put the hole in the tray. I don't know if you can see this, but I'm going to just slide this in there like this and slide it back, and that way it has a place to stand. If you leave it in this and you have to put this whole thing in the oven, you don't have room for your tray. And so then everything sits on the bottom, and I found that the heat comes from the bottom of this, and that it actually sometimes blows little bubbles into my fibrins. So then I just close that, and I let that stay in the heater and set up. And then the last thing that I activate is the bone. The bone doesn't take as long to set. So I let that start, and I already got my fraction pulled for my bone. And what I'll do is I'll just put my bone graft in the dish, and it'll depend on how much we need. And Dr. Shalama always lets me know how much bone he needs. And I put my bone in the dish, and then the same thing. With this, I'm only going to need 1 pipette because I don't have as much liquid. I have about half as much liquid, so I'm using half as much calcium chloride as I did at the beginning. And then I pour that in the bone. And then once that's put in the bone and mixed up good, then what I do, sometimes I use an instrument, sometimes I'm able just to mix it by doing like this. So then I take my bone and I put it in the oven with the other materials, and I push it back. I can put this on the bottom because I don't have to worry about the air blowing into the dish. It won't cause bubbles or anything, so I can set it on the bottom. And then now we just let all of this set up, and while this is setting up, I will go back now and finish pipetting the rest of the liquid for Dr. Shalama to use for the tissue and for in the mouth, just to have as liquid. Now we used these 4 vials earlier, and we activated them all with calcium chloride, so we can't use those, but I still have 1 vial that I opened earlier that I haven't activated, so I'm going to go back to using that vial. And then I'm just going to continue to draw. I'm going to draw off the rest of the liquid and put it in this 1 vial that hasn't been used. And then we'll use that as our liquid, and we can use it to put on our dermis or our tissue graft so that it has the blood platelets and the good platelets from the patient for the grafting. Now, if Dr. Shalama needed more fibrin or needed more plug or something like that, then we would have used what we had used a little bit more and given him a little less liquid. But for this is exactly what we need. So for the liquid, we use a monojet syringe, so I just usually open a monojet syringe and pour the liquid in. And then this we put in the room. This is non-activated liquid. He uses it around the grafting, around the areas for healing, over the sutures, And then we can also use it for anything like dermis or any kind of tissue that we use. This is the liquid that we have left. So now it's just a matter of waiting for all of our stuff to set up and transporting it to where the patient's at. After we've waited the time that we need, about 20 minutes typically for us, which sometimes it's faster, sometimes it's a little slower. I'll come back and I'll get everything out of the oven. We have our bone, which set up very nicely for the PRGF for Dr. Salama. That way he's able to take it and put it in the sites that he wants without it moving around. And then we have our fibrin. And for this case, we made 3 fibrins. Once the fibrins set up completely, you want to take them out of the oven, because once they meet their full set, they immediately start to break down. So you want to take them out of the oven, because I found that if they sit at room temperature, that they don't break down as fast as they do in the oven. So it's kind of a window. If you're in a surgery and you leave it in there for an hour, you may come back to find that your fibrins are really thin and small, but it's probably because they were left in the oven longer. Okay, the last thing I usually take out of the oven is my plug. The plug sometimes takes longer to set up than anything else. This plug here is set pretty well, but it's going to be a thick plug, not as dense. If I was to leave this in the oven longer, this would actually get smaller and more dense, and it would have liquid around it. So it really depends on what your doctor wants to do with it, to how long you need to leave it in the oven. A lot of times we like it at this density for extraction sites, when we're just going to fill the extraction site with it, because it's not as dense. It fills the whole extraction site very nicely. And all I do is take a dish. Sometimes I can get it to come out by just tapping it, but if it doesn't, then I'll just take an instrument and loosen it just a little bit so that it'll come out. And then when that comes out, you can see that I've got a nice size plug that I can actually cut into pieces that we can use in different, like maybe 2 different extraction sites, or maybe 3 if they're small teeth. But like I said, if we had left this in there, it would become a really thin, dense plug. And then at the end, this is what we end up with. We always end up with bone if we need it. We have a plug for extraction sites, or for sinuses if we're doing a sinus lift. Then we also have our fibrin layers. And then we have our PRGF liquid, which is what we use to round the sutures inside the extraction site on our implants. This is the liquid of the best material that he uses actually in the mouth. Before I take all of this into Dr. Salama for him to finish his surgery, I just want to say a little bit about the PRGF system. We've been using the blood draw and the platelet systems for a long time now. There's a lot of different ones out there. I think they all have really good benefit, and that they all are really good systems for different things. But I've found for what we do and for the flexibility you get, that the Endoret system is one of the best. You can do things with this system, make different plugs, different fibrins, different levels of bone, different thicknesses, easier, and it's a lot more user-friendly than some of the other systems out there. In closing, if anybody has any questions about it, you can post it under the video, and then I'll be reading them, and I can get back with you if you have any questions about why we do it the way we do or how we do. And I just appreciate your time.